Hello, my name is Samantha Slavin. I am an Indiana State University nursing student in the LPN to BSN program. This is a PowerPoint presentation for hepatitis C in relation to rural community risks. The population at risk, or PAR, I will be focusing on for this presentation is rural community residents engaging in high-risk drug and sexual activity. In the presentation, you will be able to find links to literature that support the population at risk focused on in this presentation, as this is an ever-growing problem around communities. In my community in particular, there are correctional facilities in both mine and neighboring towns which pose an increased risk for the community. The presentation consists of an introduction, learning objectives, a pre-test, hepatitis C education, how the disease is spread and risk factors, what to do if infection is suspected, symptoms, and how to protect self, and then also we will follow up with post-test and conclusion. There are several learning objectives that I hope to accomplish in this presentation by the viewer. Understand what hepatitis C is, explain ways that the hepatitis C virus is spread, identify risk factors associated with hepatitis C, demonstrate what steps to take if exposure to hepatitis C is suspected, identify symptoms of the hepatitis C virus, and finally, I hope for the viewer to be able to discuss strategies to protect self and prevent the spread of hepatitis C. So before proceeding with the presentation, I ask for you to go ahead and take the pre-test. This is a great way to test what you know before continuing. After the presentation, I would encourage you to take the post-test and compare your before and after knowledge on this subject. I've also included a presentation handout. So let's begin. First off, what is hepatitis C? Well, hepatitis C is a virus that affects the liver, and it is caused by the hepatitis C virus. Hepatitis C is highly contagious, and it is treatable. Hepatitis C is not simply a bacterial infection. It is not caused by casual contact, such as hugging. And hepatitis C can become chronic and lead to lifelong liver complications. So how is hepatitis C spread? Well, the virus is spread through contaminated blood from a person infected with the hepatitis C virus. The most common route we see today is through the sharing of needles or syringes. What are some other ways that hepatitis C can be spread? One way is through high-risk sexual contact, sexual activity. Also, through tattoo needles, also piercings, blood transfusions, organ transplants. Now, for the blood transfusions, it's generally before 1992, as after that, there was much improvement in testing of blood. Also sharing personal items such as razors, toothbrushes, nail clippers, all of these can cause hepatitis C to be spread to an uninfected person. What are some risk factors of hepatitis C? Several risk factors. Again, high risk, unprotected sexual activity, especially with multiple partners. Very important to always use a condom. Healthcare workers are at a higher risk due to accidental needle sticks. IV drug users who share needles and syringes. Again, blood transfusions, and along with that, organ transplants, tattoos and piercings, symptoms that may occur. Not all persons with hepatitis C will show symptoms, so it is important not to discount possible exposure due to being non-symptomatic. However, some symptoms of hepatitis C are jaundice or yellowing of eyes, loss of appetite, fatigue, vomiting, nausea, fever, and also dark colored urine, and also clay colored stools can be a sign. So what do you do if you suspect that you have been exposed to hepatitis C? It's very, very important to get tested. There are no vaccinations against hepatitis C. You can call your doctor or also contact your local health department for guidance. Your doctor will draw blood to look for the hepatitis C antibodies. And this also will do an RNA blood test. How do you protect yourself from Hep C? Practice safe sex. Do not share needles. Never recap a needle. Do not share personal items that become contaminated, such as discussed as razors, glucose monitors. And do your homework before getting piercings or tattoos. Make sure that the establishment you're going to is a licensed facility. Another great way to protect yourself from hepatitis A and B is to get vaccinated. Because there's no vaccination for hepatitis C, it is recommended by the CDC to be vaccinated for Hep A and Hep B. So I have added several sources to get more information on hepatitis C virus. Remember, when doing your research for yourself, please always use trusted sources so as not to be misinformed. One of the best ways to protect yourself is to have knowledge. So in conclusion, remember, this presentation is an overview of hepatitis C and rural risks. Remember, hepatitis C is a highly contagious virus transmitted by infected blood, may or may not show symptoms. There are ways to reduce risk factors. Be knowledgeable to better protect yourself. I would encourage you to go ahead and take the post test at this point. My hope in this presentation is that I have helped educate and raise awareness for particular population at risk and also for all those who view this presentation. I thank you for your time.